Sir, please explain functional B1.
Okay, so functional B1 Thiamine, right? So what is functional B1? Basically, to make B1 functional, we need to add two phosphates. They are coming from ATP. You know ATP, right?
Yes.
So adenosine
Triphosphate.
triphosphate. So we need to share these two phosphate to thiamine. So suppose this is your thiamine here.
Yes.
So you have to add two phosphate. So it will become pyrophosphates.
Yes.
Pyrophosphate or also called as a diphosphate. Right?
Yes.
So this is the functional thiamine or B1 in our body. Now, what we have to understand? What exactly it does? What is the main function of the thiamine? So it is dehydrogenation. It does the dehydrogenation. Right? So I have already explained in our level 5 nutrition specialist course what is dehydrogenation. Okay, let me explain it again. So this is suppose pyruvate and this is 3 carbon, right? And this is converted into acetyl CoA, and then you know the citrate and all,
Yes.
right? And prior that it has to combine with the oxaloacetate. And oxaloacetate is what? How many carbon? 4 carbon. And acetyl CoA is 2 carbon with the CoA. I am presenting the CoA in this manner. Now, whenever you need to convert the pyruvate into acetyl CoA, you need to
Release one carbon.
break one carbon, right? That is as a CO2 and add CoA. So this becomes acetyl CoA, and this is done by pyruvate dehydrogenase.
Yes.
Pyruvate dehydrogenase, right? And this process is called dehydrogenation. Right? Now, if there is a deficiency of B1, I will explain why it is deficit. Okay? If there is a deficiency of B1, what will happen? The pyruvate will not get converted into acetyl CoA. Further, there will not be ATP.
Yes.
And there will not be functional B1. That is going to be one cause. Okay, now again, if the pyruvate is not converted into acetyl CoA, pyruvate will shift to the lactic acid. Lactic acid, which will cause acidosis. Acidosis. Okay, it is going to damage your tissues. Right? So some ATPs will be there in this formation, but damage is more. Damage is more. Okay, now. So you understood what is dehydrogenation?
Yes.
Removing carbon dioxide and adding CoA. Remove CO2 and add CoA to the substrate.
Yes.
Right? Now what is carboxylation? Now in fatty acid synthase, when we synthesize the fat, we studied that we need to convert this pyruvate into oxaloacetate. At that point of time, these 3 carbons need to be converted into oxaloacetate. So we need to pump 1 carbon there. That is called carboxylation. Right? Done by pyruvate carboxylase. Done by pyruvate carboxylase. Is that clear?
Yes.
You understood the difference between the dehydrogenation and carboxylation?
Yes.
One more. Let's continue this cycle. Citrate converted into isocitrate. And isocitrate converted into alpha ketoglutarate. Right? Now, isocitrate 6 carbon. Right?
Yes.
And we need to blow out as a CO2.
Yes.
But the next substrate is not having CoA.
Yes.
just removal of carbon dioxide. So this is called decarboxylation. This process is called
Decarboxylation.
decarboxylation. So I explained three things. What? What is dehydrogenation? The main function of B1,
Yes.
remove the carbon dioxide, add the coal. What is decarboxylation? Only removal of the carbon dioxide, no CoA attachment.
Yes.
What is carboxylation? Adding carbon or pumping one carbon.
Yes.
Clear that? Now, let's come to the point of the thiamine, the functional B1, right? You are supposed to have somewhere 30 milligram. Your body stores it. Where it is stored? In
Muscle.
muscle, right?
Yes.
Then liver, then central nervous system,
Yes.
then your kidney. So some organs love to store this B1, right?
Yes.
Now, why we are deficit? Why we are deficit? Now let's take this. Why we are deficit? So there are some consideration we can call poor diet, right? Basically, it has a life of somewhere 18 to 20 days. How many days? 18 to 20 days. Means if you stop today taking B1, then you will be deficit somewhere like after 20 days.
Yes.
And you will have a lot of problems.
Yes.
Because these organs also will be in some problems, right? Now, so poor diet, then absorption problem. What happens? This is your stomach, you know that, and this is duodenum. You know duodenum, right?
Yes.
And this duodenum problems, you have pancreas here which is making juice for the digestion, right? So there are some duodenum disorder
Yes.
where the absorption is compromised.
Yes.
So that also can be the cause of low B1, right? Now, fever and infection also uses a lot of energy, and that also causes deficiency of B1. Now, what else we can add here? If basically this B1 is used in ICU, patient coming as a septic shock patient, or patient coming in like COVID level, a lot of pneumonia cases, the patient is in septic shock, right? At that point, if 100 milligram is given, that can recover that patient. How? It will calm down interleukin 17. Interleukin 17 activity will be
Stop.
calm down, lower. Then there will be low pro-inflammatory process, and then there will be low damage.
Yes.
So this is